Dear friends, a very good afternoon and a warm welcome. Thank you for joining us and attending, if not now, when, our health, our rights, our choices, ending inequalities by realizing sexual and reproductive health and rights for all. Let me start by asking you, where were you? Where were you 25 years ago? Think about it for a second. I was in primary school. And 25 years ago, in 1994, in Cairo, a global consensus emerged, and it was groundbreaking. The International Convention, the International Conference on Population and Development, linked for the first time population dynamics with development. What does this mean in practice? In practice, it means they recognized 179 governments together that population dynamics, therefore the reproductive choices of individuals, women and girls, as well as men and boys, lay at the center of development. What does this mean today? Today, it means that people lay at the heart of sustainable development. But we need to recall that consensus, because as we strive to realize Agenda 2030, let's not kid ourselves, we're nowhere near achieving those sustainable development goals if sexual and reproductive health and rights and universal health coverage aren't a reality for everyone. So there is still work to do. 25 years ago, the ICPD adopted a program of action, a to-do list. A very exhaustive, thoughtful, deep to-do list. And I'm not breaking any news to you by telling you that some items on that list remain unchecked. There is unfinished business in the ICPD Programme of Action. And today we're going to explore this unfinished business. We're going to ask, 25 years after Cairo, where are we and what's next? We could be in no better company for such a conversation. You will hear today from the directors of 2 UN agencies, from a deputy prime minister, from the vice president of a senate, from the director of a leading aid agency, and from an exceptional young leader. We're going to start today by an introduction from the European Commission, followed by opening statements from the UN Development Fund, Unfpa, as well, Population Fund, Unfpa, that's it, as well as the World Health Organization. After those, we're going to turn to 2 questions together. First, how do sexual and reproductive health and rights and universal health coverage contribute to ending inequalities? And second, what are the next steps to finish this unfinished business of the ICPD Programme of Action? We're going to explore these 2 questions with 4 speakers, and then we're going to turn to UNFPA and WHO for their reactions. You'll also see that today's speakers brought with them something personal, a picture or an object, and they brought something personal to show you what the ICPD Programme of Action means to them and to millions of people around the world. Please join this conversation. You can ask your own questions in 2 ways. First, by taking your mobile phone and going into the menu of the EDD app and entering your question in the section Q&A. Second, if you don't have a mobile phone or if the app is not working, you can raise your hand and George is going to come to you with an iPad and he's going to take down your question. You can also continue the conversation online using the hashtags EDD19 and think twice. But if you want to ask a question, don't use the hashtags, use the app, because that's the only thing we'll see from here on stage. Now, without further ado, I would like to invite to the stage Marietta Jager, Deputy Director General for International Cooperation and Development at the European Commission, for a brief introduction.
Honorable panelists, distinguished guests, ladies and gentlemen. It's an honor and privilege to warmly welcome you on behalf of the Commission at the panel on ending inequalities by realizing sexual and reproductive health and rights for all. I'm humbled to be among you And I would like to thank especially Dr. Kaname and Unfpa for organizing this panel. Tackling inequalities, especially related to gender and sexual and reproductive health and rights, is a precondition to achieve SDGs and Agenda 2030, ladies and gentlemen. The European Union has long supported gender equality and women's and girls' empowerment, and we will remain firmly committed to that. Improving it is a precondition and important development goal to reduce poverty, an integral part of human rights and gender equality. From 2013 on, the EU has contributed immeasurable improvements in quality primary health care. I'm not going to tell you all the numbers, from 90 million births attended by skilled health personnel to 13 million children fully vaccinated. Taken all together, around 500 million has been distributed per year by the EU on reproductive, maternal, neonatal, and child health. This year, as mentioned before, we celebrate the 25th anniversary of the groundbreaking international conference on population and development, ICPD, where 179 governments agreed that reproductive health, women's empowerment, and gender equality are the pathway to sustainable development. The Commission is committed now, as it was back then, to this cause, and I'm here to reconfirm our full commitment to support human development and gender equality and SRHR, especially in the next financial framework as well. That's why the Commission proposed 20% of our development aid to go to the human development. Investing in the health of women and girls is a smart investment. I want to share with you that meeting the needs for contraception, safe abortion, and maternal and newborn health care in developing regions would cost just €8 per person per year. Please remember, €8 per person per year. It's not about basic rights, it's also about low cost and also addressing demographic challenges. We will continue to support that through comprehensive and integrated programs, as we have done so far. Let me mention just a few. You all know about our Spotlight initiative, to which EU contributes 500 million, includes a specific focus on sexual and reproductive health and rights in sub-Saharan Africa, 100 million. We have supported UNFPA supplies with more than 77 million since 2012. And we reduce and support the traditional practices and gender-based violence by providing various grants through UN Population Fund and partnership with UNICEF with more than 20 million. So let me finish, dear friends, ladies and gentlemen, and honorable speakers. 25 years ago, ICPD made a milestone on women's rights. Let us deliver on those promises and not reverse the achievements. Let's work together towards Nairobi as we work together in Cairo, and let us walk the talk. Thank you very much, and very fruitful discussion.
Thank you very much, and I would now like to invite Dr. Natalia Kanem, Executive Director of the UNFPA, to open the debate.
Bruno, Ms. Jaeger, Excellencies, distinguished panelists, partners, and friends, thank you for coming. I'm really happy to be here with you today for this discussion. It's about equality. It's about how we speak about sexual and reproductive health and rights as we advance more and more choices for women and girls. This is what is at the heart of our work at UNFPA, the United Nations Sexual and Reproductive Health Agency. I would like to specifically thank the European Commission for hosting this dynamic European Development Days set of events. And being here for the first time, I'm really impressed at the mix of opportunities to learn something new as we walk through these halls. I would also like to thank the World Health Organization for the signal work being done around the world to keep our health safe, and to Dr. Tedros, who with his pressing schedule spared a few moments to be here with us today. The European Parliamentary Forum on Sexual and Reproductive Health and Rights co-organized this event, and we're very grateful to you as we celebrate in this year a global movement for reproductive rights and health and choices that began, like Unfpa did 50 years ago, and gained impetus and inspiration in Cairo during that International Conference on Population and Development, ICPD, with its Programme of Action. And I was there as a young professional. Some of you may not have been born yet. But what I remember about the excitement, and that's what we're rekindling this year, was the understanding that the paradigm was shifting. So population was no longer about census sheets, it was about the human beings, the people who make up a population. All 179 member states of the United Nations at the time recognized and endorsed an understanding that women and girls must be put at the center of development if we're to succeed, and that everyone, every single human being, has the right to decide freely whether, if, with whom, how often to bear children. Now, when we say people first, when we say leaving no one behind, we've got to listen. We've got to listen to people who are telling us what they want and translate that understanding with respect for their dignity so that they can fully exercise their human rights, including their sexual and reproductive health. And simple doesn't always mean easy. I've brought for show and tell what Unfpa calls a dignity kit. So if a girl has to flee her home in the middle of the night, soap, underwear, monthly menstrual supplies, a blanket, a towel, and so many other things are included to preserve her ability to understand that even with a temporary setback, hope can still be kept alive. Now, this dignity kit contents can shift depending on the situation, what it is. Sometimes it's weather and climate, too often conflict. But the contents are predicated on what girls and women tell us that they need, because rights and choices for everyone everywhere, especially the poorest women and girls, cannot be ignored, even in a time of crisis. Okay, you're disabled. Have we thought about what it's going to take to move you to a place of safety? For anyone that's facing inequality, discrimination and stigma and silence can conspire to bring shame to the person who should have nothing to be ashamed about. So all of these are guiding principles that Cairo established, and we move forward into the Sustainable Development Goals era with that understanding. And we're going to celebrate progress, and there has been progress. Hundreds of millions, for example, have gained access to family planning. Maternal mortality in the last 25 years has declined by over 40%. There is progress against certain harmful practices like child marriage and female genital mutilation, and with significant support from, among others, the European Commission and several European Union member states. For example, for EU Spotlight, as we heard, against violence. She decides. The support for family planning through Unfpa supplies. This progress has started to show that working together, we can act, we can make a difference. But for too many, that promise of Cairo remains unfulfilled. And as Bruno said, the panel will entertain that debate now as to why should it be that by the time the clock strikes midnight tonight, 820 women will have died from complications of pregnancy and childbirth that are preventable, that we can do something about. Part of that equation of saving lives also has to do with advocating and delivering on the promise for family planning. There are over 200 million women today who want to use family planning and yet do not have access. And of course, there are millions of girls every year 30,000 a day who are married off too young against their will or subjected to genital mutilation. And so we have a lot to do. We want to be strategic with you to get there. We have conceived of our part of the Sustainable Development Goals as 3 zeros. 0 unmet need for family planning for women and adolescent girls that want it, 0 preventable maternal death, and certainly 0 gender-based violence and harmful practices. So we want to work with you to achieve these 3 zeros and to put the universal in universal health coverage. We have to attend to these 3 elements. Yes, because the clock is ticking. It's ticking towards that deadline of 2030. And we don't just want to reduce or ameliorate. We want to see an end to female genital mutilation. We want to stop gender-based violence. We absolutely can end child marriage. It's policy, but it's also people. So when we meet in November, from November 12th to the 14th in Nairobi, led by President Kenyatta and the government of Denmark, among others, we are mobilizing to come to that Nairobi summit with concrete commitments to action. It's not a convention. It's a declaration that as we leave Nairobi, we're going to go out into the world, we're going to talk to communities, parents, whoever it is that we need to engage with, and certainly men being part of that equation, but also the private sector. We want them to come with financial commitments and with commitments to change the workplace so a woman can breastfeed in dignity in the middle of her workday, or whatever it would be to protect people from HIV, from shame and stigma in accessing life-saving care, etc. So I hope that Nairobi will be a springboard for action. I hope that we will continue to collaborate along that path that we established 25 years ago. And much more important than celebrating how far we've come, that we will plot and plan and commit to finishing that unfinished business that will bring us to where the world says we want to be by 2030. A world that has rights and choices and a concern for everyone, no matter who you are, in full equality in all our beautiful diversities. Thank you, and please continue to join us. We appreciate it. Thank you very much. Thank you. Thanks,
Thank you very much.
Thanks, Tedros. Thank you.
Thank you very much, Dr. Natalia. And I would now like to invite to the lectern Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization.
Thank you, moderator. A very long name. He said it very well. Excellencies, distinguished guests, colleagues, and friends. First of all, I would like to start by thanking my sister Natalia for organizing this very, very important panel. As you know, WHO has no higher priority than universal health coverage. It's a simple idea. Everyone should have access to health services they need without facing financial hardship. UHC is grounded in the conviction that access to health services is a human right for all, not a privilege or a luxury. And that includes services for sexual and reproductive health. We cannot truly say we have achieved universal health coverage unless women are able to exercise choices and control over their sexual and reproductive health. This is not just a moral obligation, it's a commitment countries have made through intergovernmental agreements such as the International Conference on Population and Development and the Sustainable Development Goals. We have a long way to go to honor those commitments and realize these rights. Every day, as my sister Natalia said, 830 women die from complications of pregnancy and childbirth. Around the world, more than 200 million women who want to avoid pregnancy are not using modern contraceptives. Every year, there are 2.6 million stillbirths, and 1 in 3 women and young girls have experienced physical or sexual violence. And there are an estimated 25 million unsafe abortions globally every single year. Adolescents are especially at risk. Women and girls, particularly those who are poor and marginalized, face many barriers in accessing services for sexual and reproductive health. These barriers include stigma, gender norms, lack of confidentiality, the need for parental authorization. Even when services are available, using them can spell financial disaster. The best way for countries to address all these challenges is to ensure that services for sexual and reproductive health are included in benefit packages as part of a commitment to universal health coverage. The bedrock of UHC is primary health care, which can provide most of these services for sexual and reproductive health, alongside other vital services such as infant vaccination and cancer screening. This is the only way we can realize the vision of Cairo and realize sexual and reproductive health and reproductive rights for everyone, everywhere. As you know, 2019 marks the 25th anniversary of the Watershed Agreement adopted at the International Conference on Population and Development. The ICPD Programme of Action has been a critical turning point in recognizing that human rights, gender equality, equity, and women's empowerment are crucial to effective population and development. It's recognized that sexual and reproductive health services, including family planning, safe abortion, maternity care, and prevention of sexually transmitted infections, must be guided by the needs of couples and individuals, not driven by demographic targets. WHO is committed to protecting and promoting sexual and reproductive health as part of our commitment to health for all. We are now developing a set of recommended sexual and reproductive health interventions for countries to provide as part of a package of services. The draft of that package will be launched at high-level meeting at the UN General Assembly in September. I was asked to show an image symbolizing how the ICPD movement has impacted people's lives. This picture is a perfect example. It shows students in India using an ultrasound on an expectant mother. This is a great illustration of the kinds of services that can be provided in primary health care by nurses, midwives, or community health workers. Excellencies, colleagues, and friends, I leave you with 3 key challenges. First, the access challenge. Women continue to have inequitable access to good, equally health services in many countries. Integrating services for sexual and reproductive health within benefit packages as part of universal health coverage will significantly improve the health and well-being of women. So that's good quality health services in countries. Second, the quality challenge. Despite decades of medical progress in innovation, quality of care for women's health remains weak in many countries. It's not good enough to provide services if those services are unsafe or ineffective. There is no universal health coverage without quality of care. Third, the political challenge. Ultimately, universal health coverage is a political choice. But it's not a choice that is made once. It's a choice that must be made every day with every policy decision. We need political leadership to accelerate implementation of the ICPD Programme of Action and political leadership to achieve universal health coverage. So the three key challenges are the access challenge, the quality challenge, and the political challenge. Thank you all for your commitment and support for a healthier, safer, fairer world for everyone, everywhere. And I believe together we can address the challenges and serve the people who need our services better. I thank you.
Thank you. Thank you very much, Dr. Tedros. Given the situation in DRC, Dr. Tedros unfortunately has to leave us and go back to Geneva, but we are joined on stage by Jane Ellison, the Executive Director for External Relations and Governance at the World Health Organization. Thank you for joining us, Ms. Ellison. And so now, as you may have noticed, it's not about only this half of the stage. We have a very competent and interesting other side of the stage. And I'm now coming to you to reflect on our first question. How do sexual and reproductive health and rights and universal health coverage contribute to ending inequalities? We've invited you to bring an object or a picture that to you symbolizes that. Minister De Croo, you're the Deputy Prime Minister of Belgium, and I think you brought a bottle.
I did bring a bottle. This has nothing to do with Belgian beer or anything like that, but the bottle says "No More Sexism," and it's a bottle that has been made at an event where I was a few years ago. It was an event about coding, and it was teaching young girls how to use coding. And one of the girls made this bottle saying "No More Sexism." Now, this I think is symbolic to me because, first of all, the impact of sexism throughout the world is a gigantic impact. It is, first of all, a very wrong thing to do from a human perspective. It also has a huge economic impact. I mean, the economic impact of sexism is gigantic. The amount of prosperity we're losing due to sexism is gigantic. And I also thought it was a bit symbolic because the technological world, well, has its issues with sexism, and you would actually imagine that in that world it would not be the case.
Wonderful. Thank you for bringing that bottle, and it stands as a stark reminder that there is
It's empty for the moment, by the way.
No Belgian beer. Okay. Your Excellency Janda Gakuba, you're the Vice President of the Senate in Ronda, and you brought with you a picture, which we're going to show on screen now. What does the picture show, and why did you bring it?
Thank you very much, moderator. That picture shows myself and people in front, the citizen of Kirehe district in eastern province of Rwanda, and it was a visit made in framework of Parliamentary Forum on Development and Population. So I was supposed to go and meet the leadership of Kirehe a day before to discuss about what is happening. Are the people getting the right information? Are the people getting access to means of sexual reproductive health? And what is the role of women and what is the role of men? And in that picture you can see that, first of all, I'm inviting members of parliament to go towards the communities and meet them and leave no one behind. And second message is to talk mainly to men so that they can be engaged and fight together with their wives so that they make the right choice, so that women get empowered, so that they can also give their contribution in terms of labor work, in terms of decision making, in terms of participating in governance meetings and whatever. And yeah, the message is about outreach, and the message is about men engaged, and we focus on this so that you can reach the end of inequalities. Thank you.
Senator Gakuba, what was your impression after going into that community? What impression did you bring back?
After this visit, if you can see the picture, there are more men than women. And I asked, why are these people men more than women? And they told me, women get more opportunities to get informed about sexual reproductive health more than men, and the men were invited as a big number because they needed to know. Thank you.
Very good. Excellent. Thank you very much, Senator Gakuba. Ms. Karen Yemtin, you're the Director General of SIDA in Sweden. Thank you very much for joining us too today. You brought not one, but two pictures.
Exactly.
Can you tell us what they show?
They showed two different situations. The one on your left-hand side is from Cox's Bazar. That's a Unfpa clinic in Cox's Bazar in Bangladesh with Rohingya refugees. This image is from Mazar-e-Sharif. It's from a maternal health clinic in Mazar-e-Sharif. What I wanted to underline is that sexual and reproductive health and rights should be at place everywhere, in all situations, in all countries, everywhere. In humanitarian situations, maybe we talk about it too little, but a lot has to be done. I always visit Unfpa clinics or other clinics in the humanitarian settings, and it's fantastic to see, because babies are delivered, people fall in love, but also the negative side of the reproductive health agenda happens in humanitarian settings, and we have to recognize that. This image from Mazar-e-Sharif is not a refugee situation. It's for normal girls and women in Mazar who get married, get their children. They had everything in this clinic. Contraceptives, psychiatric care, post-maternal, everything in that clinic. And it's fantastic to see. Also in the difficult circumstances, it's possible to reach them. And it's an issue that we have to deal with and work with everywhere.
It's possible and necessary.
Well, it's possible and it's needed. When sitting here, I'm also realizing I should have brought a third image, and that was from Stockholm. A couple of weeks ago, we had the pram parade with mothers and fathers actually marching for the right to abortion and the right to maternal care in Sweden, because it's a constant battle in all countries, actually.
Thank you for adding that third picture. And Mr. Aaron Atimpe, you're our exceptional young leader. You're from Ghana. And Aaron, you brought one picture yourself as well.
Yes.
Would you tell us what it shows?
Okay, so up there in that picture, you see me with policymakers. The person second to my right is the Deputy Minister of Education. Now, I grew up in a rural area in Ghana, where I sat in class as early as 13 years in the primary school, where with very brilliant and smart female friends, and then we went on vacation just to return to school, and I didn't meet them in class. Now, I didn't meet them in class not because they failed their exam, but because they got pregnant, and unfortunately, the school at the time was not the right environment for them to be. So they lost out of school. And my dream that I'm still pursuing, anytime I go back to the village, I see them with sadness, because unfortunately, their bright dreams have been cut short. Now, up there in that picture, that manual, Know It, Own It, Live It, took 4 years of advocacy, research, and then collaborative work to come up with a comprehensive sexuality education manual in Ghana for teaching comprehensive sexuality education to young people in schools. And this manual has still been made available to young people who are out of school and those living with disabilities. Now, I brought this picture because I chaired the launch of this manual in Ghana. And what this manual did is to call young people to know about their sexual and reproductive health needs and rights. And by owning it, it's telling them to know the rights that they have, to be able to own the freedoms to make choices over their own bodies. And by living it, it calls us as young people to live to the full realization of our ambitions and dreams. And this picture speaks volumes to me, because as a young person sitting here and looking back to my country and the colleague young people that I have, I know now we have the greatest weapon against our ignorance, which is information. And the night before I boarded a plane here to Brussels, I led a team of young people to review different textbooks from primary school to high school that have been developed from this manual to help teach comprehensive sexuality education in schools.
Excellent, thank you. Well, here you have it, friends. You've just seen...
All of us.
We've just looked at the fight against sexism. We've looked at informing communities. Yes. We've looked at ensuring that all SRHR, including all medical and healthcare-related services, are available to everyone, regardless of the situation. And we've looked at comprehensive sexual education. All of this and much more is part of the ICPD Programme of Action. And so when we look in depth at what this Programme of Action foresees, when we look at ensuring that SRHR, sexual and reproductive health and rights, are made a reality, they contribute to ending those inequalities. Minister De Croo, you were just in government for several years. You still are. We've had elections, so teetering. Technically, you still are. And you're a She Decides champion. How would you say sexual and reproductive health and rights contribute to ending inequalities?
Well, because poverty is extremely sexist. And we see that throughout the world. If you have poverty, you have violence, you have war. Women, and especially girls, are much more affected to it than men. And giving girls, especially girls, the opportunity to break that virtuous cycle of violence is the best thing that you can do. I think that it was Warren Buffett who said, invest in women and the rest will follow. And this is what we see in a lot of countries. If you give girls at the age of, let's say, between 10 and 14, the choice of not becoming pregnant and of continuing to go to school, that moment is a very decisive moment. And that is by giving access to family planning. And I know that very often we would say, well, family planning is culturally sensitive. Maybe, but my experience is that if you do provide it, sometimes provide it in an intelligent way, everyone uses it. And maybe it's almost a question we could ask here. Think about your own situation. If between the age of 12 and 18 you would not have had access to family planning, would you be living the life that you're living today? No, obviously not. Family planning gives you the opportunity to love someone without having to end up immediately with a baby. It gives you the opportunity of enjoying each other without having to start a family right away. And so giving that type of medical services and family planning services at that age makes a gigantic difference. It is a difference between becoming a mother at a very young age and having 6 to 7 children on average, and being able to go to school until the age of 18, having the number of kids that you want to have with the partner that you want to be the father or the partner, and being in a situation of financial independence. And in the end, if you do that, the main persons that you're going to help is that person's sons and daughters. Because a mother in poverty is unfortunately the best guarantee for her daughters to also be in poverty. So I really think it is crucial. And we are a bit at a decisive moment, because we thought over the last decades that we were going in a straight line, and that straight line was going forward. And today we're seeing that history is sometimes going in circles. And so this is the moment to make sure that we are not taking a turn and going backwards.
We need to make sure to keep going forward, absolutely.
That we keep going forward, and that we come with the right arguments. And sometimes these are numbers, and sometimes this is more emotional, and sometimes we have to be a bit more intelligent in the way we continue motivating and convincing people that this is the right thing to do. The right thing to do from a human perspective, as I said about my bottle, also from an economic perspective. And it's an argument I think that we don't use often enough.
Indeed. Senator Gakuba, are you seeing this trend in Ronda? Are you seeing that indeed sexual and reproductive health and rights are increasing, access to these rights is increasing, and is therefore impacting communities positively?
Thank you very much, moderator. The sexual reproductive health and rights, together with universal health coverage, that are things that, for me, it made Rwanda succeed. The Millennium Goals Development, number 4 and number 5, because we could monitor the growth of the population, and we also could plan effectively and distribute resources efficiently into communities. And it also helped people to understand the role of the government, but also the contribution of the communities and families. Because even if you are a poor family, you are not condemned to continue to be poor. You need to improve and get more and more resources. So the people understand that while they abide the sexual reproductive health and rights, they have now time to work. They have enough resources to spend for school fees for the children, to pay for universal health coverage, but also to invest. And this is something that is, it has been seen concretely, like between 2013 and 2010 and 2015, while more than 1 million of people were raised from under poverty line. Thank you.
Thank you very much. Ms. Yemtin, SIDA is obviously very much involved around the world. How do you see that SRHR come to play a role in your interventions? And someone from the audience has asked a very interesting question, which is, how do you fight against restrictive social and cultural norms more efficiently? And I would put it in other words, perhaps I would say, how do you bring those services in contexts where they are not necessarily welcome?
I think that, to begin from your last question, they are welcome in more places than what you actually think. And that is because people are intelligent. At the human level, women and girls, they want to go to school. They want to educate themselves and they want to have a job. Or at least they want to, or what they do want is, of course, to decide on their own lives, on what choices they make. Planners in society know that if they can plan and know the demographics of their countries, they can plan for the future of their countries. In many places around the world, we work with religious leaders. There are always progressive, if I can use that word, progressive religious leaders in all religions. The situation with one of the pictures I showed was in Afghanistan. I met with wives of imams. They were working out in the village, in their villages, to try to promote the use of contraceptives. They were themselves using contraceptives. And they had the power and the tools by just being the wives of the imams. So one has to find the different channels in different countries and different settings. But there are always change agents in all countries and in all situations. And that's what we try to do and try to work with. Because it's, as was pointed out before, it's smart for the individual to work with sexual and reproductive health and rights, but it's also very smart for a country. Economic developments of a country is stronger in countries with good rights, sexual and reproductive health and rights approach. So thus we have to take both of these debating lines or the approaches when talking to the ones who are maybe more problematic to reach.
Indeed,
Yeah.
indeed.
Yeah.
And Aaron, does that resonate with your experience in Ghana? For example, once you gave that manual on comprehensive sexual education to your Minister of Education, did you see things change? Did it have impacts throughout the educational world or beyond? Did it have impacts in your communities, in families?
Okay, so I'll give you another example. So in 2016, I was selected to join a scholars program in Ghana. There were 14 of us selected, 8 were female, and then 6 of us were male. Now, I want to tell you why I'm saying that it had an impact, because there were these 2 female colleagues of ours who got pregnant when immediately after high school. One got pregnant when she had had admission to the university. And then after the manual came into force, the government gave a policy that schools were supposed to reintegrate people or females who got pregnant and they drop out of school. So she was reintegrated into school. Another person too, she got pregnant in the level 200. And after giving birth, she came back to school. Now, after going through the 3 years of the scholars program, these 2 females are the ones who I would say, in terms of efforts towards making the sustainable development goals a reality, they are the 2 people amongst us who are making the greatest of impacts. Why do I say so? Because these 2 people together are running a business, and the 2 of them together, even before we completed college, had already employed close to 50 people. And that is the impact that comprehensive sexuality education has brought. Because of the presence of the manual, government had passed a policy that allows schools to reaccept students who got pregnant and drop out of school. So they refound their way into school. They are still pursuing their dreams. And because now they have the information, anytime we meet, they are the ones who teach the rest of us how to be careful with our sexual and reproductive health lives. So yes, the manual has made an impact, and the government is taking it serious. As you saw in the picture, I was there with the Deputy Minister of Education. And I just told you that we developed textbooks for teaching comprehensive sexuality education in schools. And I believe that sexual and reproductive health issues are not just health or women's rights only issue. These are sustainable development priorities that when we want to achieve sustainable development and address inequalities in all forms, we must not give loose attention to them, because they have very good economic development underpinning. So we have to be very careful with how we address them.
Thank you. That's such an impactful example. Now, we'd like to try a little experiment. Could you raise your hand if you have your mobile phone with you and if it has the EDD app installed? Raise your hand if you have the EDD app. Great. That's a majority. So I would like to invite you to please take it out. We're just past halfway, and we're going to ask you one question now. Go into your EDD app, take the drop-down menu, and then go to Word Cloud. Word Cloud. Then select A2. This is this auditorium. So Word Cloud A2. And we would like to ask you, what is the one thing you think is now most urgently needed today to realize sexual and reproductive health and rights for all? There is 1 minute for you to give your answer, and then we'll see the outcome right here on the screen. And I'll then invite Dr. Natalia and Ms. Ellison to react to what they just heard and to what's on the screen. All right, answers are starting to come in. You still have 30 seconds. Your answers have to be one word, I believe. Just a few more seconds. Okay, let's see what's on there. What's most needed? Ownership, raising, which I guess is going to be raising awareness, financing, abortion, unlocking investment, ownership, education and abortion are clear runner-ups. Shared access investment, political, I guess that's going to be political will, local power, safe, and then rights, and CSE, comprehensive sexual education. Thank you very much, everyone. I think it's pretty clear that education and abortion are the big winners in answer to this question. And so now I'd like to invite you, Dr. Natalia, to react to what you just heard and to what's on the screen right now.
Well, I'm really impressed to be learning myself, sitting here very committed to these issues and trying to figure out what and how do we jointly set our priorities so that we get something done. And as I mentioned, this tracks pretty well with what Unfpa has decided. that we better look after family planning. And even young people have told me, Doc, don't call this family planning. We're not planning a family. We're trying to be responsible with our sexuality. We're trying to delay pregnancy. So, you know, the term contraception, et cetera, very interesting in terms of what we formulate in our minds. Our second zero has to do with stopping people dying in pregnancy and childbirth. And the third one, which was also spoken to, and sexual and gender-based violence is real. It's real in somebody's home, but also in the standard and the expectation that you should shut up and not say anything. So for us, the timing of the Me Too movement, the fact that EU Spotlight is on the scene, very, very crucial, because that conspiracy of silence has to be broken. But in a couple of words, because I saw that Senator Gakuba, Rwanda is the country with the highest women's representation in your parliament. Now, that's part of the political power that in the world. And that's part of the political power that translates into that understanding that people don't do it by themselves, that societies have to set the tone. And part of the economic equation, in fact, is investing in young people and investing in family planning so women can be liberated to participate fully as they do in your country. And Ethiopia is another one that's doing very well. Of course, the Nordics have been on that theme for a while. My real plea is that the teenage girl around the world is in deep trouble. And we're the ones that have to rescue her. We're the ones that are confusing her. So we want her to be sexy, we want her to have the latest this and that, and we're going to throw her out of school and condemn her to being stigmatized as being the you fill in the blanks, and there are a lot of ugly names that teenage girls get called because of this conundrum of a normal part. You know, I'm a pediatrician, that's still my inherent identity. I fight for women's rights, precisely as the panel has said, because who is it that is going to benefit from women's rights? Certainly her children, but all of us as society as a whole. So I insist that when we talk about comprehensive sexuality education, and that came up on the messages, as UNFPA, it's the politics that blame us erroneously for wanting to give information to young people that's going to protect their life, it's going to protect the respect that they receive in their community, and it's going to enable them not to fall off that cliff that early pregnancy and early childbirth represent. And I just want to wrap up by saying that some of you who are part of this discussion, whether you're in the panel or in the audience, know very well what I mean. But there are others of you who were never even born when Cairo happened. And young people deserve our trust, they deserve our support, and I find that you've been very strategic in insisting that information is power in this type of an equation. So the politics that divide us, the confusion that is sown in the minds of young people, we've got to take some responsibility for that, and there are actions that we can take to ameliorate that. And culture does change. You can't tell me that culture is static. It changes every single day. And I've been with indigenous tribes. I've been with people who are very set in their ways from 100 different perspectives, who when they understand, you know, Marlene Timmerman is in the audience. When you see a Maasai warrior who changes his mind about FGM because he knows that his daughter might die, you're telling me that culture can change in a positive way. So we've got to work with communities, we've got to share what we know, but we also have to be prepared to listen, as I think I said and many other people have echoed.
Thank you, Dr. Natalia. Ms. Ellison, I saw you nodding your head vigorously. You seem to agree.
Very much so, yes. And I was thinking in particular that on the last example that was given of, I once met a lady who was walking from Maasai village to Maasai village, spreading the word about FGM. A one-woman campaign has probably changed the life of thousands of young women. So you brought that to mind. There were it was a fascinating discussion, and there were 2 points I particularly drew from hearing the other panelists. The first was around the centrality of this agenda to so many other vital agendas in terms of achieving the SDGs. I think we would all agree here that sexual and reproductive rights are critical in their own right, but I think perhaps what we need to continue to stress is how vital they are to underpinning so many other achievements that we're trying to work towards. Some great examples were given. Aaron gave the example of keeping girls in school. How access to family planning keeps girls in schools. We can't achieve SDGs around education if we don't keep girls in school. If you think about the comprehensive services that we want to offer rape victims, to prevent unwanted pregnancies and HIV, about helping women to stay in work, to get over those experiences and be able to continue to work. I've seen firsthand the vital impact of providing mental health support to victims of sexual violence, to people who've experienced FGM, to be able to allow them to lead a full life and contribute to society. So I think that was a really interesting theme that came out. Not just that these are important rights in and of themselves, but they're actually central to achieving so many of our other massive global goals. And then the other point I would just make is, I guess Dr. Tedros focused on the role of sexual and reproductive and health rights within UHC, within universal health coverage. But that universality point is one we do need to bear in mind. And I was particularly taken by DG Yamtim's point about the need to provide support for people in very difficult settings. And the reality is that millions of people are now living for sustained periods in crisis and in conflict areas. And I think that far from thinking of this as something we have to have temporary solutions to, we now have to be able to provide vital services such as sexual and reproductive services to girls and women living often for years, often for much of their lifetime in a conflict setting and in really very straitened circumstances. So I think in committing to the universality of this, we have to bear in mind that that means for everyone, including those living in the most marginalised situations. Just in reacting to the poll, education, I think, came out pretty much the top. And from a World Health Organization point of view, I think for us, that means continuing to assert the evidence base. This is not a nice theory that sexual and reproductive health rights are key to so many things. This is not a theory that has never been tested. This is something for which there is vast amounts of evidence. And I think that it's incumbent on us as a evidence-based agency to continue to assert that evidence base in the face of those who would perhaps deny it.
And we've just seen a number of very telling examples to that point. Yes, Minister De Croo.
I think education was great, it was up there. I was a bit surprised that abortion was so high. Mm-hmm. And look, and don't interpret me wrong, I am living in a country that has been very progressive on abortion, and I think we are right on doing it. But this topic is way more than abortion. And this is one of the issues with which we are confronted today, is that some people on the conservative side reduce SRHR to abortion. And it's not. It's way, way more than that. And I think we have to be quite clear on it. Every abortion that has to take place, in my view, is one too many. But if it has to take place, I'd rather be able to say it has to take place in a safe way and so on. But we have to be careful in this topic. If you want to make progress in this topic, you have to be a bit careful in what the message is that you are bringing. I think in a lot of countries, if you are saying, well, SRHR, priority number one is abortion, you're going to go right into the wall. Priority number one is, as you said, it's education. It's giving access to contraception. It's explaining to boys, not only to girls, to boys and girls, mean what the mechanics are, and they have the right to say no, and they have the right to discuss certain things. So,
well, could we conceive that in some contexts the number one priority will be education, but perhaps in other contexts the priority will be access to the full range of medical services, including abortion?
Yes, and what we have seen, I mean, the gag rule, which has had such a devastating impact on this domain, was because, in the view of the United States, SRHR is about abortion. And so many organizations got their budget cut because a little part of what they do is provide access to abortion, whereas 95% of what they do is something else. And indeed, Unfpa, I think, was the prime example. So I don't think we should be silent about it, but I think we should be careful in explaining that it is way more than that.
It is one part of so much more, absolutely. We're now moving into the part of the conversation where we're going to examine what do we do next? What are the next steps to finish the unfinished business of the ICPD Programme of Action? And to get right into the thick of it, we've got a question from Alexandra in the audience. And I'm turning to UNFPA and WHO because Alexandra is asking, how are international organizations working to unlock domestic financing to fulfill access to contraception in FP 2020 target countries? Would you like to speak to this?
It's a very astute question because money talks. The budget is a reflection of our priorities. And in my opinion, we've really not been imaginative enough in terms of garnering resources. And beyond monetary resources, we also have to set the bar a bit higher as to what we expect in an employment setting. And I gave some examples when I said, if you want to breastfeed at work, or if you want to be tested for whatever, are we accommodating that? Now, at the Nairobi summit in November, when President Kenyatta opens that meeting with his personal commitment towards ending FGM, part of his commitment, and Health for All is part of the priorities of that particular country at this moment, but it can be generalized. If family planning is not in the budget, then it means it's not regularized, and we're trying to accelerate the pace of delivery. Moreover, from the theme of looking at new ways of bringing people to the table to pay, not just private sector, but I think we have to understand that people normally pay for health care as it is. So women are actually plunking down money for reproductive health services out of their pocket. So my question is, how can we galvanize the ability to get to economies of scale around that? And moreover, from the standpoint of universal health coverage, this is why, again, Dr. Tedros's momentum on this is really building. Everybody should have a guarantee of a basic level of health services and universal access to contraception. That universal has been there since Cairo 25 years ago. So I think we can and we should do better.
Thanks. Ms. Ellison, would you like to chime in?
Yes, I think from WHO's point of view, I've already mentioned the importance of continuing to develop and to convey the evidence base for the things that we're talking about. Because I think that breeds confidence in policymakers when you can point to really strong and constantly updated evidence base for what works and what people should invest in. I mean, in many countries, we are working alongside countries, particularly ministries of health, to devise technical programs from scratch. And, you know, it's actually, it's no small thing to start a program from scratch if it's not an area that perhaps your country has previously invested in. So as countries decide they want to invest in programs in this area, we work alongside them to devise those programs, drawing on best practice, what we know has worked, and making sure that we can co-design with countries programs that meet their domestic needs, their domestic resources. We're also increasingly looking at how we invest in the health workforce of the future, because as more and more countries move into the middle income bracket, the requirement for health workers is simply enormous, and therefore we need to think of how we can help people to train vastly more health workers than we have today. And then the last thing, I think, to come back to where Dr. Tedros started, by absolutely reinforcing that we see sexual health and reproductive rights as core to universal health coverage, and that they are not divisible. As we continue to encourage more and more of the world to go in the direction of universal health coverage, then again they will go down this direction of offering sexual and reproductive health and rights too.
Thank you. Turning to you all, I would like to ask what's, in your view, what are the next steps to finish this unfinished business? For example, Aaron, in Ghana, what would you say could be the next steps to make the ICPD Programme of Action a reality for everyone?
Okay, so I would like to take it from the young people's perspective because
Sure.
I'm a young person.
Do.
In Ghana, even though a lot of progress have been made, unmet need for family planning and contraceptives in Ghana among young people is still 51%, and that is high. And from the last maternal health survey that was conducted in Ghana in 2017, at the current rate of progressing, it's going to take Ghana another 25 years to be able to reach half of the population with contraceptives. And that is a long period of time. The ICPD Programme of Action is already 25 years. We cannot wait for another 25 years to reach only half of the population. So we need to make progress. So I would like to tackle this question from different perspectives. First, from the local level. I think there are still a number of cultural barriers to access to contraceptives, access to SRH and family planning services. So we need to be able to engage traditional leaders. And I give an example. In Ghana, I work with the Ghana Health Service, and we have this program where we engage traditional leaders. We call it Time with Grandma and Time with Grandpa. Chiefs are custodians of culture in the traditional areas, so we engage these chiefs, give them the information. Then usually in the evening, people go to the chiefs for information and stories. So they use this story time to educate people about SRH. And I think we can upscale that. And then from the national level, I think the problem has to do with funding. The ICPD Programme of Action, I think all governments made commitments as to what percentage of the budget should go into funding SRHR. And in Ghana, for instance, in May, we had a youth SRH parliament. It was the first ever in Ghana, and I'm happy that I was the speaker for that parliament.
Excellent.
And I'm giving this example because I think it's a solution to the problem we have towards the unfinished business, because this was a youth-led parliament discussion that brought the policymakers, this time not to talk, but to listen to young people, our need for sexual and reproductive health information. And the Deputy Minister of Health stayed through the discussion. And I'm happy that right after that parliamentary discussion, we were calling for increase in financing for SRH. 2 days after that, there was a stakeholder meeting to discuss how to fund SRH in Ghana. So I think that at the national level, we need to be able to empower young people ourselves and women who are usually at the disadvantaged side to be able to call government into account. I think our governments made these commitments during the ICPD on our behalf, so we should be able to call them to account as to what they are doing to meet the thresholds that they committed themselves into. Then at the international level as well, I know that 1/3 of the ICPD financing requirement was supposed to come from donors and then development partners. I know they are doing a lot, but research shows that the funding requirement has been dropping both from the donor side and the side of governments as well. So we all need to recommit ourselves to the commitments that we made earlier. I think the reasons we had before making those commitments when the ICPD Programme of Action came into action in '94, if for anything at all, those reasons have become more compelling. So there's even the more reason why for us to recommit our efforts into that. So I think from the local level, we need to, culture is still a barrier, and we need to find a smart way of using culture, which seems a barrier, as a tool to making information available to people. Then at the national level, we should be able to get governments to commit. And then when we have a lot of force coming at governments, like in Ghana, we had the CSE manual, and now the Ministry of Health and Education called a stakeholder consultation to see ways of funding SRHR. We need to put pressure, and we must continue to call our D2 bearers into action.
All right, thank you very much, Aaron. Karen, I'm turning to you with a specific question from Maxence from the European Commission, because I think you could come up with a brilliant example based on what you just said before. Maxence is asking, in order to make this SRHR for all a reality, how do we engage on social norms and social norm change to address gender inequalities? Could you give an example or two, for example, of working with a religious leader or anything else that comes to mind?
I can go back to the same country I spoke about before, and not being so specific on where in the country, but in the country we worked with religious leaders in the mosques, of course. And in some parts of the country, the imams wanted to provide condoms to the ones who came to the Friday prayers.
Very good.
2,000 disappeared, 2,000 condoms disappeared in a very rapid pace. So they were now busy trying to promote, to find new ones. But anyway, to produce new ones and buy new ones. But what they also did was that they spoke about the why. Why did they provide these condoms here on the Fridays? And it's always possible, as I said before, to find these change agents also in the conservative settings in other places. In Southern Africa, we have been working with churches, with church leaders, religious leaders in these places, providing sexual education for young people below the age of 18, boys and girls, because boys must also be included in this. Which is an important take in all of this.
Absolutely.
So there are actually several examples, and it is very, very possible. I would say for those of us who live in this part of the world, we also have a lot of fighting to do, because there are non-progressive forces wanting to back this agenda. But we also have to remember the huge changes that has happened in our country in not many years, actually. At the turn of the last century, at the beginning of the last century, it was forbidden. There were no contraceptives, abortion, etc. There were many, many prejudices in our countries. We worked with all of the same change agents in our countries, and we have to do the same in other countries.
So identify your change agents,
Exactly.
Identify your allies.
And
really.
they are different in all countries. They can be sportsmen or women. They can be church leaders, or they can be politicians, business leaders, or whatever. Academics.
Absolutely.
Identify them. Talk to the people.
Thank you very much, Karen. Senator Gakuba, what would be the next steps?
The next step, as they said, is now to turn to youth. Youth, adolescents and youth, they are more vulnerable to comparing to adults, because adults can take their own decision very easily, but for the young ones, they need to be informed at very young age. They need to get services in health centers, the youth-friendly corners in health centers that can feel comfortable to tell to someone what they feel and what they encounter in their life. They also need to have more facilities, as His Excellency the Vice Prime Minister said, better to prevent than to cure. What do we do with our kids? Do we take care of their education? Do we take care of the free time they have? Free time they have, what do they do? Are they only on the social media, or like in developing countries after school? Maybe they're just in the community doing nothing, and if you don't take care of them, someone else will do. So the parents must take responsibility, and the teachers also. There is some good experience now in Rwanda just to fight against teenage pregnancies and unwanted pregnancies, so that in classrooms we have what you call one of the teachers become an auntie of the girls in the school. So she knows the situation of every girl, and she communicates with the parents. And the parliament that is voting the budget, we know that we have a budget for helping the school in terms of supporting girls' education. So they can have food, they can have pads, they need pads, like those who come from poor families, but also if there is a change in terms of behavior, the auntie is around to consider and to discuss about the kids and the parents and the teacher to know exactly what is happening. And now we have what we call It's just in terms of fight against gender-based violence for young ones, but also for women. We have one-stop center at every hospital district, where if you get abused, you go to the one-stop center, you get psychological support, you get medical support, and you get legal support, so that the author of the abuse is called upon and is called in trial. So this is what we are doing. And I also think the governments, both the executive and the legislative, should work together to create the conducive environment that policies and laws can facilitate communities to get quality services in terms of sexual reproductive health. Thank you.
Okay, wonderful. Thank you very much. We're now moving into the very last part of our discussion together, and so I will turn to all of our speakers once to ask them the following question. We looked at next steps, but what is your one personal next step? What will you do next to help make SRHR a reality for all? May I start with you, Minister De Croo?
Okay. I think that this topic, and we've talked a lot about girls and about women, but this is by definition a topic which is also about boys. And if we really want to achieve something, then you need to talk to the boys as well and include the boys as well. When we talk about feminism, the definition of feminism is equal opportunity and equal rights for women and for men. So by definition, this is my frustration. This is a topic that so often has been seen as a topic which is about women. So by definition, only women can talk about it. So by definition, the answer is supposed to come from women, which I think is wrong. The answer is also coming from men. Indeed. And so if that would be my personal pledge, is to try to convince as many women, as many men as possible, that it's not enough to say, I'm not against gender equality. The real question is, to men, is are you willing to be a champion in this? Absolutely. Are you willing yourself to make sure that in whatever organization you are, women and girls are getting the same opportunities and the same rights as men?
Absolutely.
And their men need to play a crucial role.
Great. And we'll include ourselves, won't we?
Yes, well, I hope Excellent. I can include you at least.
Absolutely, for sure. Senator Gakuba, in 30 seconds, what would be your one next step?
For me, the next step should be to accelerate the ICPD agenda by increasing a multi-sectoral investment in youth and adolescents.
Thank you very much. Excellent. Dr. Tedros spoke earlier about bringing in the private sector. Sorry, it was Dr. Natalia who spoke about that, and that joins your point beautifully. Karen, in 30 seconds, your one next step.
Continue work on coalitions. We were also part of the She Decides, so we are also parts of the She Decides. We try to mobilize other donors to come along, financing SRHR, and always remember the R at the end and never talk about only SRH, but always remembering that it's a right. So building coalitions, to remember the rights and bring more money to the table.
Yes, excellent. Thank you, Karen. Aaron, in 30 seconds.
Okay, so I've always been doing advocacy, so I'm going to do that with increased commitment. And I want to continue to build young ambassadors among my colleague young people so that it wouldn't be a one-person job. And I'll continue to hold policymakers into account. And I want to begin my advocacy and commitment right here by calling on all of you upstage here. You are in very influential positions of power. I want you to be able to use your power to continue to pursue your commitments that you've made towards realizing sexual and reproductive health for all. Thank you.
Thank you, Aaron.
Thank you.
And you're already showing yourself what powerful advocacy means. Okay, very well. Now, Ms. Ellison, in perhaps 1 minute, what would be your one next step, and what do you make of this conversation?
Well, I've talked a lot about putting SRHR at the heart of our push for universal health coverage. I mean, this is an important moment for UHC. We're working towards high-level meeting at the UN General Assembly in the autumn. I think that we have to keep asserting that this agenda is at the heart of UHC and continue to push for UHC. I think it's important that when we talk about that universality, that we do talk about marginalised and vulnerable populations, that we really mean no one left behind. And I think one thing I've taken from this conversation, particularly I think inspired by Aaron, and something that I don't think any policymakers anywhere in the world, whether in developing countries, whether in developed countries, are getting right, is we don't put young people's voices at the heart of policy making. Too often young people are the passive recipients of services, and they're not sufficiently involved in shaping the commissioning of services and telling policymakers what they need. So I think that it's a good takeaway for all of us to say we should look to do what more can we do to make sure that young people's voices are heard in the way we design and commission services.
Thank you, Ms. Ellison, for the WHO. Dr. Natalia, finally.
Well, thank you, Bruno. Unfpa is on the ground in 155 countries around the world. And the people that I get to work with are smart, they're passionate, and they are trusted by governments to provide the type of quality data and evidence that you'll see next year in the 2020 census round. So my next step is all roads lead to Nairobi. And in that set of commitments that are going to come out of that meeting looking towards 2030, I think that the unity there and the political will that we're going to show is going to prove the currency of investing in SRHR. So I'm talking about investing in sexual and reproductive health services and acknowledging the rights of women for self-determining their course, investing in young people and across all of our beautiful diversities, and definitely that women are not going back. Thank you.
Thank you very much, Dr. Natalia. Would you please join me in thanking all our wonderful speakers today?
Thank you, Bruno. Nice job.
So what did we learn today? We just scratched the surface of what it means to make SRHR a reality for everyone. What can we take away? We know that differences of access to SRHR, inequalities in SRHR, are linked and lead to other inequalities of gender, in economics, in education. And so this means that inequalities in access to SRHR decrease the possibility of having societies that are economically and politically stable, that are fair, and that are inclusive. In short, if you don't guarantee access to SRHR and universal health coverage for everyone, you're pretty much shooting yourself in the foot. What else did we hear? We heard that turning to youth is the key. We heard in Ghana the beautiful example from how keeping a girl in school has ricocheted in terms of employment way beyond her school years. We've heard how SRHR and UHC are part of Ronda's positive stories, success stories in the previous years. And we've learned that we will just not get to Agenda 2030 if we leave SRHR and UHC for all by the side of the road. And by the way, SRHR, as Dr. Tedros reminded us at the very beginning, are a full part of universal health coverage. The conversation continues. As Dr. Kenem announced, the next step is Nairobi, where Unfpa, the Kenyan and the Danish governments will convene the Nairobi ICPD 25 summit in November to mobilize political and financial support. And finally, the conversation also continues online by using the hashtags EDD19 and Think Twice. And we would like to thank you all very much for attending. If not now, when? Our health, our rights, our choices. Enjoy the rest of the EDDs.